Good afternoon. My name is Lois Pribordum, and I'm so excited to be with you here today. I'm going to be your moderator for this afternoon session. And in a moment, I'll introduce our wonderful group of panelists, but we're going to talk about the efforts that have been made in Baltimore City to reach the communities that have faced historical traumas and may have been overlooked. We'll talk about our VALUE Baltimore initiative, and VALUE Baltimore stands for Vaccine Acceptance and Access Lives in Unity, Education, and Engagement. The project is a collaboration with IVAC, Morgan State University, Micah School of Social Design, and the Baltimore City Health Department. We also work very closely with community partners, including JPIGO and many of the health systems, community-based organizations, and the faith community. And probably most importantly, our ambassadors and ambassador coordinators that make all of this happen. So at the core of the program is to reach the goal of vaccinating 80% of the community with COVID-19 vaccines. But more importantly, we want to ensure that we're reaching those communities with the lowest levels of vaccination and understands their day-to-day challenges. It's through the ambassadors who come to work with us very closely with the communities that we're able to develop our messages and programs and help explain the vaccine to address their needs. And there's a co-creation process that is really central to what's happening. And it's important not only that we in the organizations running this know what to be able to say, but the community has a say in being able to shape why vaccination is really so important. So ultimately, we do reach that 80% goal and hopefully build trust with the community for the longer term. But first, I'd like to introduce everyone and that will be talking today, and we'll hear a lot more from our impressive panel that we have here. So I'm Lois Pribordum, as I mentioned. I will be your moderator for today. I'm a senior advisor for policy advocacy and communication and the principal investigator for the VALUE Education Initiative, partnering with Morgan State University, Micah, and the Baltimore City Health Department. And I'm joined by the co-PI at Morgan State University, who I don't know what I would do without. Wonderful. This is Dr. Yvonne Bronner, so she'll also be on the panel. She's a professor and founding director of the MPH DRPH program at Morgan State University that received the maximum 5-year accreditation under her leadership. She is a former registered dietitian with the Academy of Nutrition and Dietetics. Her research has involved the breastfeeding promotion and weight management in African American communities, as well as school-based health. Then also is Dr. Teresa Leslie, who has joined our program at IVAC. Dr. Leslie is a research analyst and community engagement strategist with the national and international expertise in the areas of health systems, community development, infectious disease management, equity, and justice. She heads up the training efforts for our ambassadors on the VALUE Project and a whole team of people behind all of this, and has really been a key person in not just training our ambassadors about the science, but also the social and behavioral aspects to build vaccine confidence. And she is the person that has been delving into a lot of the data that are showing us where the coverage is low on our team. So she'll be able to talk about how that shapes our program. Then we have Lenice Baylor, who is a Baltimore native. She received her education through Baltimore City Public School Systems, graduating from Baltimore Polytechnic Institute, and later what is now known as Notre Dame of Maryland University. She is currently a full-time maternal and child health liaison at Health Access Maryland, connecting vulnerable populations in Baltimore City to evidence-based programs to improve birth outcomes. She is an ambassador coordinator for our pregnant and lactating women's group. And, it's been a huge honor to be able to work with Lenice, as well as Kiona Mayo. So Kiona has a Bachelor of Science in Human Ecology. She teaches classes for the newly injured people. Kiona was Ms. Wheelchair Maryland for 2017. She is an ambassador with our People with Disabilities and Underlying Conditions group, DUC, and one of the greatest advocates that I know for the disabilities community. So welcome, Kiona. And then finally, Brandon Clayton, who is with our Young Men's Ambassador team. And he is a social entrepreneur, mentor, community organizer, and also the executive director of Young Successful Leaders, Inc. We build youth who build youth. His future goal is helping to bring positive change to youth and families here in Baltimore City. And we are very happy to have this wonderful panel. So I'd like to just get started and start off the program. I told you a little bit about the goals and the 80% goal of trying to get most of Baltimore City vaccinated, which is a huge goal. The good thing is we're well on our way. So in Baltimore City, as of today, we've reached about 69% of the eligible people to be vaccinated, but there's still a bit further to go. And as you delve into the numbers, I think we'll find out that certain neighborhoods also have some very low rates. And Dr. Leslie Teresa will speak a little bit about more of that in a bit. But underlying all of that, we also have some trauma and the historical perspective that becomes really important. And many people within those neighborhoods, it's not necessarily that they don't want vaccine, but maybe can't access the vaccine or have problems of even trusting the system. Dr. Bronner, I'd like to start off with you. Would you be able to explain that a little bit further and what some of our challenges are in building trust in these communities?
Thank you, Lois. And I think where I'd like to start is with our value title, because I think we put a lot of time and effort into that, and it really speaks to some of the issues that I will go into. Vaccine acceptance. This is the first part of what we of our value mantra. And the acceptance piece does back into the historical trauma. But it's not only about acceptance, but also access. And our coordinators and ambassadors have been very clear about that. And then this lives in unity. And one of the things I like most about our project is that it is trying to unify Baltimore. Even though we have 9 or 10 value groups, we work together. And we're working together on behalf of Baltimore, not just one separate group. And what we want and what our wonderful coordinators and ambassadors do is engage our communities. I'm going to talk about building trust, but nothing can build trust better than actually showing up and doing something. And that engagement piece is so important. And then finally, as a part of our title, we have education. And education can often be persuasive. It can often be something that is perceived as negative. But our education is really to enlighten and to empower. And so with that enlightenment and empowerment, what our ambassadors are trying to do is help people make their own informed decision. And I do believe that that has gone a long way. And so you mentioned the issue of So what's underlying some of the barriers that we're facing? And of course, we know that some of it lies in the mistrust that has gone on historically. And, people can bring up the issues of Tuskegee, Henrietta Lacks, even we had our first presentation about Providence Hospital. There's so much that we could talk about. However, what we are trying to do is not wallow in the past, but allow the past to pave our way to the future. And that future is bright for Baltimore. And what we're hoping for is that with our ambassadors out there educating the public, and that they will be able to see the value in being vaccinated so that we can keep our city open, keep our businesses open, keep our schools open, and move forward.
Great. Thank you so much, Dr. Browner. And going back to the goal that we have in reaching 80% of the Baltimore population, one of the things I think that we've learned is that it's not a homogeneous population. Mm-hmm. Even within our Baltimore City project, we have 9 different ambassador groups. And we look into not just what's happening at the overall level of Baltimore City, but we also look into community statistical areas, or CSAs, and neighborhoods. Mm-hmm. So Teresa, I'd love if you could comment a little bit more about how we actually look at the numbers and what those numbers tell us, because at the surface, it looks like we're doing a fairly good job, and we are doing a fairly good job. I'm really confident that if it wasn't for a lot of these efforts going in Baltimore City, that we wouldn't be reaching the neighborhoods that we're reaching today, but we've got a bit to go. So Teresa, could you comment on that?
Yes, and I think the first thing that's important to talk about is that Baltimore is a city of neighborhoods. And Andrew, if you could pull up the slides. And so a lot of times we talk about zip codes, but going beneath these levels, you have something called CSAs, which are community statistical areas. And then you have the neighborhoods. And what we're kind of going by is starting at the community statistical area, which is what the Baltimore City Health Department is using. And if you could go to the next slide, now remember this, zip codes, community statistical areas, and neighborhoods. So these are 2 maps that our team has created. And I think it's different. There's the percent. So Baltimore City percent of unvaccinated, which means vaccinated would mean at least 1 dose, and number of unvaccinated. So a percent and a number. And I think just looking at the 2 maps besides the color, I think what's very clear in the actual percentage is that the kind of the butterfly effect is very clear. And we see the darker areas there are the kind of low vax areas where we need to increase the number of vaccinations. And that is this all the way in the northwest is Dickiesville. This right here kind of coming to the west is Rosemont. And then you go down into the south and you have Cherry Hill and Curtis Bay. So in that area, those are the areas, and that South Baltimore area is quite, it's about 21% and 23% of the people who have been vaccinated. But if you go over to the number of people who are unvaccinated, who remain unvaccinated, we see some, I would say the black butterfly becomes a little more nuanced. And we see particular areas, again, South Baltimore, which is Cherry Hill, Curtis Bay, Hawkins Point, Brooklyn, which kind of remains the same, but Cherry Hill is a lighter shade. So we see kind of a difference there. And what's also interesting, Dickiesville, which is again in the northwest, we see in the number of unvaccinated, how it doesn't seem as high a priority area. And if you go up into the northeast on the number of unvaccinated, into Sedonia, Frankfort, Hartford, and Echodale, we also have very high numbers of people that are unvaccinated. And largely the Sedonia, Frankfort area, one of the reasons why there's so many people there is because it's the most populated area of or I would say CSA in Baltimore. So if you have more people, then you're going to have more, I think 10,000 people live in that area. So that's something that is kind of missed when you kind of only look at the percentage rate. And this is why we kind of look at these maps and look at the numbers versus percentage, so we can make sure that our ambassadors who represent different groups do community outreach in those areas. And I think it's very important to kind of bring in there or mention that, yes, we do have 8 different value communities. If I'm not mistaken, Lois, you could correct me, that's the young men, the youth, disability and underlying conditions, pregnant and lactating, immigrant, Latinx, Orthodox Jewish, and older adults. And what's significant about this strategy is that no matter where you go, you're going to have you're going to have people who represent all of these groups. So everywhere, people, they're women who are pregnant, they're young people, they're children, they're older adults. So that is our strategy, is to get into these areas that are actually, find these areas where you have people who, where either there's a percentage, a low percentage, or a high number of unvaccinated individuals. And that is our approach that we're using. And I just want to say before I close that if it's not for the work of the coordinators and the ambassadors who work very hard going to events, talking to people, getting into discussions with people, and the key part is building that trust that is needed, which may not necessarily be a result of the vaccine, but a general distrust that's out there. And this is something that they're facing every day. And I can't thank them enough, and I can't appreciate them enough for the work that they're doing. So thank you.
Great. Thank you so much. And so we know where the problem is and what we really need to do to be able to bring immunization rates up. But I'm wondering, what are some of the challenges in going into some of these neighborhoods and reaching the people that we really need to reach? And Lenice, I'd like to start with you. If you could just describe some of the challenges that you face on a daily basis.
Thank you, Lois. First, I want to start off by just highlighting how it is important for the pregnant and lactating population in Baltimore to understand that by just being pregnant and delivering a baby here puts you at risk for an adverse outcome. And most of these contributing factors that lead to these adverse outcomes are preventable if they're connected to the right resources. So COVID is just another preventable factor that, if not protected against, could lead to poor birth outcomes and or death. And one of the biggest fears in our pregnant population is that, specifically regarding to the vaccination, is that they don't know the effect that it will have on their baby developing prenatally. And then one of the biggest fears in our lactating population is that they don't know how it will affect their milk supply. And so combined, both of these women in both of these groups, they have a fear of getting vaccinated and becoming too sick to properly care for their children or properly carry their baby. And so all of their, concerns and fears are valid because they're not just making a decision for themselves, they're making a decision for their baby as well. So the most and best that we can do is just stand by, be available and ready to have these conversations with these women and their families and hope that it's not too late.
Thanks, Lenice. And I think one of the things that you've brought up often is that these women also have a lot of access issues. Mm-hmm. Could you just talk about that a little bit?
So in regards to access, specifically with the pregnant population, living in areas where there are not equitable access to healthcare, pharmacies, markets. So it's almost if there is not a pop-up clinic that is at a convenient time for them, then it's almost impossible for them to get vaccinated. And then you have pregnant women who are working and they have to take time off to go to their prenatal appointments. And if they get vaccinated and suffer a side effect, they may not have time to take off from work to care for themselves. So that's another fear. And then also, just in all populations, we have individuals who have lived in communities for years, who have seen their communities destroyed by unfair policies and practices. And little has been done to rebuild these communities. So they just have a distrust. And as we're out here speaking to people and providing them information about the vaccination, and also being encouraging and letting them know that hopefully this is just the beginning of a way to start conversations around delivering sustainable healthcare and other resources to improve their health outcomes holistically.
Great, thanks. And speaking of access, Kiona, the population that you work with has a lot of different issues. Can you speak a little bit to how you reach them and how you help solve some of their problems?
Hello, Lois, thank you. Well, I'm going to ask a question. I just wanted to start off with a little statement first. Like my experience as an ambassador has really been eye-opening. And in my community, there's a lot of disparities and just like lack of resources that have always been there. And what we really were always looking for is just a good faith, to make things more inclusive in our society. And, like some of the things that we have always kind of struggled with is lack of accessible, affordable housing, lack of employment. And, it is important. October is Breast Cancer Awareness Month, but it is also National Disability Employment Month, women's reproductive health. And to talk about pregnant women, how can a woman from my community get a PAP screening if we're unable to get on the table? So that's one thing. Lack of lack of reliable transportation, social isolation, poverty, and students, in Baltimore City, and that graduate with a certificate instead of a diploma really have a hard time getting on to higher education. When it comes to COVID, some of the things that, we're still seeing, is the transportation issue. And I know we have the, free cards that we give out and the transportation is free, but there's only a significant number of, cabs that are accessible that the city do have access to. And, another thing is the accessibility of the clinics. I have done a lot of the site assessments, for these clinics, and, even a clinic that is in a new, but it only has one sidewalk to get to the school. That is an issue for people, like in my community. And sometimes not even knowing where the accessible clinics are, or clinics period. I'm on social media, I'm on different things, and we don't always get to see it being advertised to us, in spaces where we are, where we can find, these clinics that are accessible to us. We also have a caregiver crisis, that is really challenging. How do you social distance 6 feet from someone if they have to help you, if they have to help you get dressed? So I just really hope we can start meeting people, like in their homes where they are, because I just feel like in my community, we won't get to that 80% mark, like that goal that we want to reach as a city.
Yeah. Kiona, you have just done such an amazing job, not only helping meet the needs of the people in your community, but educating all of us about how we can be more sensitive and how we can think about some of these things that we often take for granted. So that's just a huge contribution to bettering all of Baltimore City, is to make sure that we think about, you know, the many people that have disabilities or underlying conditions, and taking action to make things easier. So I'd like to turn it over to Brandon. You represent one of the populations where we have some lower rates of coverage in vaccination, and there's probably many reasons for that. So I was wondering if you can talk about some of the challenges you face on a daily basis in the young men population, and what you're doing about it.
Yeah, so thanks, Lois. Thanks for bringing me on too as well. But so what I want to talk about really is that you know, we've done a lot of canvassing that the Young Men's Group have done, a lot of clinics we've attended, and just having those certain conversations. And I think we have spoken on this during these conversations, right? Is that building that trust, right, with our people and our residents in our community, you know, and making sure that we're being informative and encouraging them to get, you know, vaccinated. I done ran into numerous of people where as though they thought about it, they may not thought about it, they don't trust it. As I learned a lot of feedback, but really just informing them about how important it is, because especially where we're at now, with almost coming up with year 2 of being in this pandemic. And there's a lot has been going on. I know, like you mentioned earlier, we want to help get to that goal of 80%. And Kiana also mentioned another great point when she was saying about like the job opportunities and making sure that we're caregivers. It's a lot to this, right? And it's going to take a lot more than all of us right here to get this goal done. But I know it can happen. And that's, you know, that's the importance of it. Like I said, running to numerous of people. It's been a pleasure to be a part of it and do this work as far as like the community engagement. And I just think that we can get there as a team. Just continue to build that trust, continue to talk to folks, continue to encourage them, let them know we're here, continue to get to the ones that can't come out. Like Kiana said, some people just can't come out their house. Well, how can we get to you and encourage you? And how can you get someone else to get vaccinated as well? Because that's what it's going to take. It's going to take all of us to reach that number of 80% throughout Baltimore City. So,
yeah, it absolutely is going to take all of us. So I'd like to turn it to talking about some of the things that you are doing to reach 80% of the population, or reach your populations. So Lenise, you've done some things with social media. Can you tell us a little bit about that? I think you're on mute.
I apologize. So we've been conducting some different themed lives on Facebook from the Be More for Healthy Babies platform, highlighting breastfeeding, and just having candid conversations around why us as ambassadors got vaccinated. And we're looking forward to hosting another one coming soon, and hopefully incorporating different value communities and not just the pregnant and lactating group. We also have been conducting drop-in Zoom sessions where women can just drop in, ask some questions, and hopefully we have the answers to those questions. And then moving forward, in the as it's getting colder outside, we're looking forward to hosting a lot more indoor events with already standing community organizations, and then also to serve as our Spanish language only community. We are looking forward to having a standing dedicated time for that population to call into our bilingual ambassadors and ask and have their questions answered, and also, you know, with the potential of scheduling them for a clinic.
Wonderful, wonderful. So a lot of what we do as ambassadors, or as what you do as the ambassadors, is you talk to various communities and help try and build trust. But there's some things that often you face where people just don't want to talk to you, or have some real problems with the vaccines. I'm wondering, and maybe Brandon, you might want to take this one, talking about some of the people that you face on a regular basis that, just say, well, it's my decision, or, I'm healthy, I don't have to deal with this. How do you deal with that?
Yeah, so that's a great question. And like you said, I've ran into it, like I said, by now, of course, numerous of times. And it's just that really just continuing the conversation. It's been a lot of conversations where people may have stopped and been like, I don't want it. And I kind of not try to combat them and, force a debate kind of, but kind of still want to encourage them, because the information I'm sharing with them is very important. And really, how do I get in their mindset and change their thought process? Because, hey, if I get the vaccine, I can be safe. Some people that I ran into have actually had COVID and they have thought about it again. It's like, okay, I'm gonna go get vaccinated now, because when I had it, it was very, very bad. I got very, very sick. And that's what it's happened in a lot of recent conversations I've had. Most of these people, I would say like 65% had caught COVID, had COVID. And now they're going back and like, I want to get fully vaccinated now, because I don't want to go back into that phase again where I had COVID-19 and take those risks. So it's just, like I said, just conversating, encouraging them to our best of our ability, because like you said, as ambassadors, we're just here to encourage them and share information, and do the best that we can on our hand. And I'm hoping that they do go and get the vaccine, and also encourage someone else to get it as well.
Yeah. And sometimes it gets, it's hard to be patient and hard to just wait for people to come around. So there have been mandates now. And I'm wondering, how have mandates changed the conversation for either the good or the bad? Kiana, do you want to start with this one?
Yes, I can take that one. I mean, I think I think it's twofold. On one hand, they work well. When I wanted to go back to work and do things, I knew that it was better for me to be vaccinated because it protected me, but also protected my family. But then you have a lot of people, and I occupy two different spaces in this conversation. That I am a Black woman, but I'm also a woman with a disability. And, a lot of people, like in my community, they don't quite like the mandate. Some of it, is just a distrust of the government, but I try to, educate them and just, let them know that, getting the vaccine, like I said, it protects you and it protects the other vulnerable people, around you. But I think also it brings up, just like a deeper conversation that we can have. Some people in my community, they feel like an afterthought, like in this initiative, what I hope really comes out of it is that we start to change, people's hearts and minds, because, and I think Teresa and Brandon may have touched on this also, people with disabilities are in all of the values groups. Like I said, I am a Black woman, but Christopher Reeve, who I also work for his foundation, he's a white rich man, but we may have started our worlds at different ends of the perspective, but we ended up in the same place. So the disability community does not discriminate, does not matter your race, age, economic status, none of that matters. Anyone can join this community at any time. And like I said, what people, like in the community are really looking for is just a good faith effort, and just seeing that, one, society cares about us as a whole, and also, like governments and local institutions. Baltimore is sometimes known as a medical town, because we have these great medical facilities here, but a lot of people in my community, they have lack of access to, like healthcare. So, I hope when what comes out of the initiative for Value Baltimore is that we can implement some lasting change in both of the communities that I'm from.
Yeah, some great points. And Teresa, I'm going to turn it over to you because you do a lot of the training of our ambassadors and how you talk to various people. I'm wondering if you can just provide your comments or thoughts about how do you deal with people that are, how do you suggest that the ambassadors, or what ideas have the ambassadors come up with in talking to people that are like highly hesitant? They just don't want to get the vaccine for various numbers of reasons.
I think that a lot of it, and I'm kind of summarizing some of the things that I've heard from the ambassadors, but to use metaphors, I know quite frequently with the young men's group, they talk about people who have like some form of hesitancy about the vaccine. They use the metaphor of using putting on your seatbelt, that you might not have an accident. Somebody from the young men's group like Brandon, you may be able to speak to that a little bit better than me. But I think that one of the characteristics of the ambassadors is that they use empathy, and that they come at people, they don't judge them. And provide not only information on maybe not just COVID-19, but understand their situation, a lot of like what you talked about, Kiona, and learning from them, learning what, while COVID is important to us, well, what is important to you, and kind of building that relationship. And I think moving forward, it's important that we kind of find a way to keep in touch with people, so that that is really where the trust is built within communities. But that idea of, the use of metaphors, and there are many, and I can't think of them off, but the seatbelt one really, well, you might not get into an accident, but you wear a seatbelt because just in case you get into an accident. So, the same thing with the vaccine, you may not get COVID, but you just, get the vaccine to just ensure that you stay healthy. And just understanding where people are coming from, I think, is very important.
Yeah. Now we have some communities where, again, we're not reaching them as well as we'd really like to reach them. What are some of the things that we're thinking about to really try and ensure that we're getting that peer-to-peer conversation going, that we're starting to build trust? And maybe Dr. Bronner, I'll hand this one to you. What are some of the things that we're doing?
Well, let me say this, Lois. This probably is the high point of the work that we're doing, because at first there was a run on people who wanted the vaccine, and we didn't have the supply. And so now we've come to the part of people not wanting the vaccine as much as we have the supply available. Now, you recall back to the maps that Teresa showed. What we're noticing in that black butterfly is that we have opportunity. And this is what I always like to say to our ambassadors. We have an opportunity to go out in communities that may not have been reached out to in the past, but now we're going to go out and show them that we really care. And so what we're trying to do now is identify and hire, even at this point in the project, hire new ambassadors who live in those areas, because they really are known, they are respected. And these are people who have so much to offer these communities. And so we have just championed the fact that we can go out and bring these new ambassadors into the fold to help us not only reach this 80% goal, but several people have alluded to what's coming after this. And what we're saying is we want a healthier Baltimore even coming out of COVID. And so, yes, what we're going to do is get these new recruits, and we're going to go into the areas where we can continue to move toward that 80%.
Great. And then there's a couple of questions that have come through dealing with like what's involved in training. What do we actually do? There's, I'm wondering if maybe Teresa and any one of the ambassadors might want to take us through the training process and how we go about it. And also, some of the techniques like motivational interviewing or the materials that we provide.
I want to start by saying that we at IVAC do provide the training, but I learn from the ambassadors all the time by talking to them, by visiting them in the field. And this is really an amazing group of people who really know how to do community outreach and really know how to talk to people. But also what we're facing now with the level of hesitancy is, don't assume that the people are ignorant or stupid. These people are coming with real information that they believe is right. And sometimes I've been stumped at their questions. But our training generally includes information on COVID, latest updates on COVID, but also different forums where, so we have I would consider it training too, the think tank, and then we have questions and coffee. And that's really about community building and letting the ambassadors know each other and sharing information in the field. So it's a combination of technical training, but just interaction, community building within the group, and also assisting with talking to people. But one of the things I like to emphasize and I want to say is that, we're in a society now where we're looking at the unvaxxed and the vaxxed, and we're making the assumption that the unvaxxed are one conglomerate of people who are just stupid, and they're not. They have their ideas, they believe in their ideas, and they can back their ideas up. So it's up to the ambassadors to really engage with those people in these thoughtful conversations to kind of maybe have them think a different way. So again, it's two parts to the training: technical and just how to talk to people and continue the conversations.
Yeah, and Teresa, I'm so glad that you brought up, the fact that this is really a co-creation exercise. It's really as much about the people in the communities teaching us about what they think, know, feel, etc. Our ambassadors, our ambassador coordinators that bring up so many different issues and help us resolve that. And I'd love to turn to one of the ambassadors or ambassador coordinators. Which one of you would like to comment a little bit more on the training process and maybe how we go and get our materials and messages that work in the communities?
I'll go.
Great.
I would like to say, like, the biggest training tool that we have to offer is the ability to listen, because we have to keep in mind that this is never work that has never been done before. Like, I know I've never lived through a pandemic. I know most of, the population in Baltimore City hasn't lived through a pandemic. So all of this is about learning and understanding. So there's no set protocol that we can use. We don't know. We're just out here learning and understanding. And the more we learn and understand the population, the better we can deliver resources and education to them. So that's the biggest tool that we have.
Great. So there's some other questions that are starting to go through, and one of these is actually, I haven't read through the whole thing, but it's from Mark McGee. Would there ever be a panel where people who have COVID could come on and talk about their experience and what it was like to have it and how it changed their mind to get vaccinated? Hearing directly from those people could help others also. It would be like when we showed sick people on oxygen to get people to think about quitting smoking, firsthand information on how it affected people personally. Anybody have any thoughts on that one?
I did. So to actually speak to that, I know a lot of the ambassadors in the pregnant and lactating group have actually have been COVID positive. So when they're out there speaking to people, they are giving firsthand experiences about how it felt to have COVID and why they were vaccinated. And that is one of the biggest talking points, to have actually speak from experience.
Great. So another question comes about our long-term plan and sustainability. And I'm going to put our panel on the hot seat here, because this has been something that we've been talking about quite a bit. And it says, what's the long-term plan sustainability of the ambassador approach in terms of looking at other diseases like NCDs for community engagement? Dr. Bronner, do you want to start with that one?
Yeah,
I see you smiling.
Well, there's a backstory, but we're not going to do the backstory today. But let me say something about education. The good thing about education and about the model that we have, no matter what the future is, Baltimore will never be the same. It's because we have come together in this value community, valuing people, uniting them, educating them, working together. It's the best experience, and I've been at this business a very long time. It's the best experience I've ever had. This model is going to sustain itself. Now, what we hope for, though, is that programming that we've been so impactful, that this program will be funded to be sustained. And that will allow the people who have been trained to continue to do the important work, as was pointed out, toward the other conditions that were here way before COVID. And we certainly want Baltimore to be healthier as we move forward. So our hope is that we can apply the same methodology that we have, the same modeling that we have to the problems of other chronic diseases and other issues that can make us holistically a healthier Baltimore.
Great. So there's still a few other questions that, what do you feel works best in building trust within communities? What argument are people most sensitive to? I know this is a bit of an unfair question considering all of the access challenges, but I think this is a big meaty question. And love to hear from the panel. Who wants to start?
Well, I can say, for me, that listening to people is definitely important. I've had, conversations with people about, well, why isn't cancer, like medicine free, or like just other conversations about other diseases and things. And I can say that I really do hope that, like this initiative does carry on, because listening to the community and what their needs are, and just not putting them down, and just giving them resources, just helping them, if it's like a dog program, or it's more needs, or clothing, or if it's a clothing, books for kids. Like I really hope that we are listening more to what these communities, like really need, and just finding out a way of being able to, it'll take funding, it'll take, people's time, just caring about what people are going through, and just making a good faith effort to meet people where they are, and just helping them to come up with solutions for some of the problems that they have. We're never going to fund our way out of making everyone's life better. It's just not realistic, but if I can teach a person how to fish, that will sustain them more than me just giving them a fish for tonight.
Great answer. Anybody else want to take that one?
I'm piggyback off what Kiana said. I do feel like it's really important to listen to the community. And while we're out doing our outreach, when we're setting up our tables, like really coming back with some of those things that they have identified as a need. It's important that we're coming with fresh food boxes. It's important that we're having activities for the kids. It's important that they know that it's not just about the vaccination, that we are really here to help them and really bring back what they're saying to, these higher powers, to see if we can make a change or make something happen. It's just not, I find like one of our greatest strategies is when we're out hosting things, saying, this is this type of event, but you have ambassadors here who are ready to have a conversation if you're ready to talk about the vaccination, and not just a, event for the vaccination, but we're here and available when you're ready. And just to know that the community cares. that we care about the community. So yeah, it's just really important to listen to them and to know that hopefully a change will be coming soon.
Thanks, Lenise. And this next question is perhaps related to that. Is, do you have any anecdotal stories or evidence that from those in the community on the importance of ongoing conversations? So not just that one-time encounter, and the fact that it can take multiple encounters to change someone's opinion about vaccines. Brandon, do you want to take that one?
Yeah, I was listening into the questions, but yeah, I definitely want to chime in on it because I was thinking of it's actually funny. Me and James actually, our coordinator was actually talking about having like some sessions going on here and to have some sessions going on at morning, but have them ongoing. So it's just like not that one conversation where I heard it one time and that was it. I never saw these guys again. But being consistent with it, and I think that's the approach that we have to take, especially when you talk about community engagement, not just being there, hey, we got this vaccine and that's just it. That's all they came here for. No, they're bringing us fresh foods. They're being more engaged with our young people. They're engaging in our families because we had to build that community trust and we have to take care of all of our communities as well. At the end of the day, that's very important. And people will see that and they will notice that and they'll take initiative or that they really cared about us. Excuse me, but that's really all that I had to answer that question.
Great, great. So there's another question that I think is asking for more information about, you know, some of the things that you do on a daily basis. And if you could talk about where and when you engage community members. Are you knocking on doors, meeting people in parks, holding seminars? Can you talk about some of the activities that are ongoing and how you decide what types of activities you do?
I can speak to that. So one of the activities that we have coming up on Friday, hopefully if the weather permits, is we're going to host a trunk or treat within Cherry Hill Homes, where we'll be having candy, fresh food boxes, Pampers. Someone donated us some costumes, and we have a lot of donated clothing. And also, again, just adding that we have ambassadors that will be there ready to talk and communicate with anyone who wants to talk about the vaccination. We have also, again, like I said, we have our standing sessions. We're at play groups where moms who are mostly lactating, not too many pregnant, but where moms are lactating, asking questions about the vaccination, and we're able to provide answers to the best of our ability. And we're also just walking around the neighborhoods. For people like in neighborhoods where people wouldn't dare come in or dare, you know, are too scared to just walk around and talk to people because of statistics or things that they've heard. We're just walking and talking to those people, and you would be surprised how people respond to you because they're so often overlooked or because they look a certain way. People, you know, oh, I'm not going to go over there and talk to them. And you would be surprised the conversations that you would have and the things that they have to contribute and, you know, and what you can learn and just how people feel. And then even when they say, okay, well, I'm not interested, I've never heard no one say, but I won't pass this information along. So they're still willing to take the information and give it to someone else.
That's great to hear. And Kiana, could you answer that question? Because you know, your group, the Disabilities and Underlying Conditions group, can sometimes require different approaches. How do you decide where you go, or can you talk a little bit to where you're spending your time?
Yes. For me, well, like I said, I have done a lot of the site assessments. So as many of those clinics that I've gone to, I like to see the aftermath, as I call it, once all the bells and whistles are there. And, and it also gives me an opportunity to get to know some of the other value groups and to see some of the work that they're doing. So, I sign up for, tabling events, and done it at the Patapsco Flea Market. We have another one at Clay Pots coming up, and just some of the the different areas. And I like getting to know some of the partners that we've partnered with in the different like neighborhoods, some neighborhoods that I'm not like familiar with Dickey Hill and Curtis Bay. So I've done some clinics and even the little canvassing in that area, just to get I've born and raised in Baltimore, and it's said I haven't been down there as much, or I didn't know as much about those areas. So this is really giving me the opportunity to get to know people where I was not going before. So I have definitely enjoyed doing that.
Great. Great. So we're coming up on, there actually are a few more questions which I would love to be able to answer, but I do want to give everybody a minute to add some final remarks. So I want to thank all of our panelists for discussing all of the great information and talk about all the great jobs that you've done in identifying some of the real issues and figuring out how are we going to address some of these issues through a peer-to-peer approach. And so I'd like to wrap it up, and I'm going to go in the backwards direction from what we started with. And let's start with Brandon. Any final remarks?
Yeah, just to share out, this was a great session, a great webinar, some great information that we shared here today. I'm just closing out just to continue to encourage and to continue to do the work that we do in our communities. Continue to serve, continue to inform, and support, all our community residents and things like that. And look to get to that goal of 80% throughout Baltimore City.
Great. And Kiana?
Yeah. In closing, I just would like to say, I hope we can continue, being engaged with people and, change some hearts and minds, because at the end of the day, it doesn't matter if we're white, black, or whatever, with a disability, without, we have a lot more in common than, we do differently.
Wonderful. Thank you. Lenice.
And I just would like to say that since working on this project, there has been a lot of community going on. And you would be surprised of how many like different community organizations have reached out or see what we're doing and want to partner. They want to know how we can help, how they can help us, like things that they've donated. And it just like really just invalidates the whole idea of what people think Baltimore really is. I mean, what it is versus what it really is. And I see that more and more every day as I'm out in the field. And it just helps lead to our overarching goal, as Dr. Bronner has said, to heal Baltimore and really give it a different view of how people see us.
Great, thanks. And Teresa.
I just want to say thank you for the three of you for being on this panel, and thank you to all our ambassadors and coordinators who are doing an excellent job out there, in building the trust and building on, I would say, rebuilding our communities. It's just a wonderful job that's being done. It's an exciting project to work on. And I will give my time back, I guess, to Dr. Bronner.
And Dr. Bronner.
And let me just say, what is warming my heart right now is the fact that I hope that those of you who are attending this webinar can see that the jewels, the absolute jewels that we have in our ambassadors and in our coordinators. These are the best people I have ever had the opportunity to work with. And our Baltimore will never be the same. I'm not even worried about it, whether it gets funded or not. Baltimore will never be the same. Baltimore is a jewel. And it's a jewel because we have these absolutely wonderful, committed people. And I just wish us the very best through COVID, but more importantly, after COVID.
And I just want to thank all of you and all of the people in the community that are working so hard, because it's everybody working towards a goal. And this really is about the longer term goal of making this a better place to live and really building trust. And I just feel so honored to be working with all of you. And I want to thank you and thank Andrew for helping us set this up. And we didn't get a chance to answer all the questions, but if you want to add any questions, we'll try and answer them and get you out the recording as well. So thank you so much for joining us.